Well, the next thing we were to talk about is sexual activity. How often are you having coitus? Because that is going to affect how what family planning you will use, and the timing. The timing is very important when it comes to family planning. Now, if this guy is only coming, if your partner is only coming once in a month, maybe you will choose a family planning that does not require you to take every day. Okay. uh, as opposed to someone who has their partner living with them. It means they will be able to follow through with pills, for instance, because they are having coitus every day. They have to prevent pregnancy every day by taking the pills, correctly. But what I am going to emphasize is the timing, because what I have realized with people who have their partners living very far and coming once in a while is that they they forget. Okay, the partners only tell them maybe the day they are supposed to come, and because of that, what happens is that the client is going to be rushing to the hospital and requesting for, let's say, an implant. Okay, so when they come and they request an implant, the problem is that if the implant if okay, mostly all hormonal family planning method, maybe apart from the depot, most family planning methods will require that they get inserted within the first 5 days of starting your menses. Should those 5 days uh, finish before the family planning is inserted or taken, then it means that the client has to take the medication, or rather wait for 7 days before the family planning can be active. So it means that the 8th day is when the family planning is going to be active. So if this partner is coming today and visiting for 3 days, you see that family planning is not going to be effective. And that is how people end up saying that I got pregnant while still using family planning. You see? So timing is very important. So the most important thing to talk with your partner is timing. They should let you know in good time when they are coming, or if they are just forgetful, there is an aspect of accommodating your partner. You can choose to just have a long term family planning method, inserted, a reliable one, so that you don't end up getting an unplanned pregnancy. The other issue under the factor of lifestyle is partner involvement. Relationship and lifestyle, under that we have partner involvement. Now, when you talk about partner involvement, what we are saying is that do you have a partner, or is this a person you just meet and they are not invested in you at all? Because it means then that that is entirely your job to make sure that you're preventing pregnancy. If it is a partner who is involved and they are supporting you with the family planning method, I have seen clients who come to the hospital and they support their partners, and they help their partner to choose a family planning method. And I think that is the best thing. That is commendable. That is how it should be, because it is unfair to have the lady take all the weight when it comes to family planning. And I want people to comment down here some of the crazy side effects you have experienced while using family planning method. Okay, there are people who are going to bleed for an entire month. There are people I don't know, sometimes one would think it is unfair to be a woman, honestly. The side effects that these family planning things, the medications have. Anywho, I have had one. Let me tell you a story about a lady who I was caring for. She came to the hospital and requested for family planning, and I went through the file, and I realized that she's being treated for vaginal bleeding that has been caused by this family planning method. So I went ahead to advise the client and told her that maybe she should take a break or change into something else, like maybe a pill. The pills help with regulating the menses, and she insisted on that family planning method. So when I went ahead to inquire why she would choose something that is causing her side effects, she said that the partner does not want her to use family planning methods, and that is why she has to use one that is very concealing, and that is why she prefers the injection even when it is giving her side effects. So you see the kind of involvement I'm talking about when I'm saying partner involvement. Women, it is your right to access family planning methods. It is your right, because I have mentioned earlier that the weight of caring for the family. Women are the primary healthcare providers, so if you're going to have a lot of kids, then it means that the weight really is going to be on you. Yeah. So I have also had clients who have had to leave their appointment books behind because they do not want their partners to know that they are using family planning methods, and I don't think that is fair at all. Yeah, the best thing is to come with your partner to the hospital. Na hiyo si kukaliwa men that hiyo si kukaliwa. You know why? Because when you come to the hospital, you get to understand the risks, the side effects, and the requirements. Sometimes the lady has started the family planning halfway the menstrual cycle, so it means then they have to wait for 7 days, and on the 8th day is when the family planning method is going to work. So if she comes home and she's trying to explain to you and saying that daktari alisema tungoje 7 days, siku ya 8 ndio family planning itakuwa effective, there are partners who will not understand, and that is how the lady is going to end up pregnant while still on family planning methods. So partner involvement is really an important role, and I think sometimes when we are dating, there was a counselor who mentioned that during the dating is not a feeding program where you just go and eat and have fun. These are the questions you want to know. You want to know if this guy is for family planning or not, because if he is not for family planning, it means then that you're going to have around you're going to have so many kids, and you know that one affects your life. That one affects your life, your career, and everything. Anyway, I was to give you, should I call it a secret? What I did when I was using family planning methods. I went and interviewed my mom and my sisters. I have 2 sisters and my mom, and I was curious to know what family planning method they had used, what was working for them, and those were my options. I decided to try those ones first. And halfway through, I tried something else that was outside of that, and wow, I experienced side effects. I don't know. It was really challenging. Well, the family planning methods that they had used and I tried worked for me. All of them worked for me. I gave the same advice to my younger sister, and it worked for her as well. She happened to try Depo, and it really affected her. In fact, she had to wait for a very long time before she could get pregnant, and therefore maybe you should try this and give me feedback. I don't think it is going to cause you any harm to just try. Like the next time you're going to the clinic, have a list of number one, have a list of the family planning methods your sisters or your mom used and try them. Number 2, seek advice. Do your research. Google is there. Google, read, and when you get to the hospital, ask the right questions. And it is your right to access family planning methods. So adios.